Hello, hello. Welcome to a Better Glen party from the 1619 Hewlett. We had a watch party uh, this past Sunday, and we looked at the episode and had a panel discussion. And Laura and I just want to some more about what we learned in the episode, also what we heard from the participants. Please feel free to use the chat function to ask us any for your own insight if you were present at the event. So we're going to delve in, and Laura, Laura is a member of a Better Glen that locally at least goes without introduction, but I will ask Laura if there's anything else you would like to share about yourself.
I think, yeah. It was just, for me personally, it was really interesting and enlightening to be a part of the panel on Sunday. It was the two of us and two other ladies from our community. I think there was a lot of really good information shared, really good stories shared, personal stories, and good interaction from the audience. So I think just in general, this watch series for the 1619 Project has been already sort of creating relationships among the community and spurring conversations that I haven't heard happen in this community. We're only on the second, we've only finished 2 so far, so I'm really excited to see what the next 3 will bring too.
Yeah, absolutely. So for folks who have not the episode entitled Race, I'll just kind of give some that is presented in that series, and then Laura and I are gonna take a little deep. So as you could imagine, it's titled Race, and it really was about this concept of racism and race, and how that intersects, how that manifested by way of the legacy, and then sort of where we see those in current day, where we see racism and an indicator of outcomes present. And so there was a lot of dialogue, maternity mortality rate as well as birth mortality rates, talking about legislation as it relates to marriage. There was also snippets of talking about social policy and that impact in social services and child welfare. So I want to kind of start with of racism and race. Laura, what were your thoughts about that?
One thing that I learned, or I think I maybe kind of knew or intuited before, but the episode really articulated really well, I think, is that race, in terms of it being like a biological classification of people, that is a product of racism and not the other way around. Racism came first, the prejudice that comes along with that, the institution of slavery that came along with that, and then the biological classifications of race and all the kind of pseudoscience that went into shoring that up and justifying that came afterwards to justify the racism and the prejudice that was already in place, that the whole kind of institution of slavery was built on. So that was something that stood out to me. Like I said, I had never really thought about it in terms of that sequence before, but I think it was articulated really well in the episode that really these biological classifications of race and how people are different according to race, how their bodies are different according to race, that was all really a product of people trying to justify the institution of slavery and enslaving certain people.
Mm-hmm. Mm-hmm. Yeah, and I mean, even locally, what the conditions of enslaved people are on plantations, and so Butler was mentioned. Hampton Point was mentioned, and right here near Brunswick, right? And so that was resonated with me in some ways, and that those spaces are right here. And one of the things that this maintenance of the slave society, as you mentioned, right, like having to maintain this belief that you have a population of people that you believe the institution of slavery because of their skin color, right? And then slavery ended, or at least the legal enslaving folks on plantations. Once that ended, having to create further, you no longer had sort of this, slave is black as opposed and white, as opposed to now they're free. And so, the white man and the black man is made in terms of hierarchy, right? And sort of talked about how we see the pictures of the water fountain and the black water fountain, right? Like all of that needed to be institutionalized by the treatment of people based on skin color. What else stood out to you as we watched the episode, or in?
I think anybody who watches it, especially anybody locally here in our community, like you said, because there were connections and there were scenes where they were walking around Butler Plantation and Darien, and the brick chimney stack that they showed in the background. You can see that when you're driving down 17. I think it's really hard to watch. It's a tough episode to watch. It's tough content to listen to. And they even addressed that in the episode. Nicole Hannah-Jones, who's the producer and the host, when they were discussing the culture of sexual violence on the plantations and the impunity with which the enslavers committed that violence, she said, it's unspeakable. And what they said was, yes, it's unspeakable, but we have to speak about it because we haven't in the past. And there are ramifications and there are implications that run down through history all the way to today. And unless we connect those dots, and unless we talk about it truthfully and openly and honestly, that's really the only way to address and resolve those inequities that we're still seeing today.
Yeah, one of the things that, and this really happened organically on the panel, 3 out of 4 of us sort of shared our birth stories because I highlight some of the disparities for Black women and Black children as it relates. And so I was really, what really sat with me, and even kind of how impression on me that evening, was how different our birthing and one of them really being an indicator of race, and that one had received and believed that there was a race was the driver of that difference in treatment. And so, personally for myself, I had a home birth and made that choice after some doctor visits that I kind of knew in my gut that I experienced, or it's not going to have the experience that I wanted to have. And so sort of went in that way. Lady talk about a very traumatic experience that she had. I feel like her body was being honored, thoughts were being honored, and particularly just that Black women can endure more pain, and she was in a significant amount
Oh, I think we might have.
This is why. And Laura, you shared yours. Anything that you want to expand on that?
Yeah, you cut out for a second, but I heard you saying, talking about your experience, talking about the birth story that another lady on the panel shared with us, that had elements of her not being listened to, not being believed when she's reporting her level of pain or what she's experiencing with her own body. And I shared my story. My youngest daughter was born here in Brunswick, and my experience and my thought process going up to that birth was completely different from the stories that you guys shared. I was never concerned about the level of care that I expected to receive at our local hospital. I felt like I was listened to and cared for and taken seriously, leading up to my birth and then during my birth as well. So you're right. Those personal stories are, it's impactful to hear those personal stories of local women who have such different experiences. But I think it also, it bears out in the data as well. One of the things that I did kind of preparing for the panel on Sunday was look at the numbers in terms of for maternal mortality, for women locally, and infant mortality. And what we're showing on the screen here is what I showed at the panel on Sunday. This is data from the Department of Public Health at the state level. So this is maternal mortality numbers in Georgia overall, and it's looking at the number of pregnancy-related deaths per 100,000 live births. And the number at the top is for non-Hispanic Black women in Georgia, and the number on the bottom is for non-Hispanic white women in Georgia. So you can see that the maternal mortality rate is more than twice as high for Black women as it is for white women in Georgia. And that's currently, I think that's 2018 to 2021. So that, again, lines up with kind of the personal stories that we heard on Sunday. And then looking at infant mortality rate, I went to a few different places to get this data and put it all together so we could see how it compares. But what this is showing is the number of infant deaths per 1,000 live births from 1994 over to the left to 2021 over to the right. The gray line down there at the bottom is the overall infant mortality rate in the US, which stays pretty steady over that time period. The orange line is the infant mortality rate for white infants in Glenn County over that time period. So you can see it's slightly higher than the national rate, but still sticking pretty close to like around 10 per 1,000 live births. The blue line is the infant mortality rate for Black infants in Glenn County over that same time period. And you can see it's just such a stark contrast. And I think hearing personal stories is important, but it's very important. But I think sometimes people will write off individual stories and say, well, that's just one person's experience. That's, may not be representative of a group of people or anything. But when you can tie those two numbers like this that show actually it is valid for Black women to have concerns about entering in the hospital to have their baby, or when we have infant mortality rates that are so much higher and maternal mortality rates that are so much higher that fall along racial lines. And what we know is that there are no biological reasons for why that should be. There's no physiological reasons, in terms of Black women's bodies versus white women's bodies for why this difference should be. These point to structural racism in the healthcare system that are leading to these outcomes. And so the more we can be aware of this and acknowledge it and take it seriously and take it as something that should prompt us to action, the better chance we will have at resolving this and fixing this.
Yeah, for sure. We had a few folks in the chat just indicating, Vendolin saying that, the level of care should be the same across the board, regardless of race. Heather is also mentioning that the decision making in the birthing process is not only important, but is a human rights issue. And I certainly, Heather, felt that when my husband and I made the decision to have a home birth. It didn't come without a lot of barriers, and that was in an area that was more resourced than here in Glenn County. But there were certainly a lot of restrictions and things that we had to endure in making that decision. But absolutely, and it's also not covered under insurance. And we talked a lot about that, right? Talked about the fact that women's health care is, and particularly while pregnant, is so limited. And so folks that are choosing to have alternative birthing um, outside of hospitals are often, it doesn't come with insurance. Even when we talked about postpartum care, right? There's a limitation around what that looks like for women, and that also contributes ultimately to the health of the mother and the infant. So, absolutely. Laura, one of the things that you had said um, that really stuck out to me as we were talking about that, and you sort of made that point as you were speaking about this sort of sense that this is history. There's no need to pay attention to this, or I'm not racist, or I'm not benefiting from such a system. And so you kind of separate yourself from this idea that, race and racism does impact outcomes. What would you say for folks that might be feeling that way?
Yeah, I touched on that in the panel discussion just because presenting that as my perspective as a white person watching the episode, the very difficult content in the episode. And I mentioned that one thing that I felt myself doing was trying to distance myself from that content, almost like subconsciously, that it viewing it as something that happened in the past, and yes, it was horrible, but thank goodness it's in the past, or viewing it as something that even though it happened, in Darien, we were literally seeing scenes of local geographical places.
Mm.
I wasn't involved in that, or nobody that I know was involved in that, and it's almost like a self-protection thing to kind of protect yourself from the very difficult truths that were being discussed in that episode. And so what I tried to encourage other folks, if they felt themselves kind of having that reaction while watching that episode, or when having other conversations about race or uncomfortable, what can be uncomfortable topics, to really try to acknowledge that, to resist that temptation to try to distance yourself from this topic, not to make yourself feel guilty or to make it about yourself at all, but to just try to, in a very clear-eyed way, understand the way that these events have impacted, are currently impacting our culture and our society and our community, our local community.
Yeah, for sure, for sure. One of the things that there's so many things in this documentary like that stuck with me, but there was a statement that Hannah Cole made, and she said that this idea of or this concept of racism is that it took, I'm trying to make sure I say it right. It said it took the race of the mother and inherited a political condition in the womb. And I thought, wow, like the moment someone is, all of the things that we as mothers think about when we find out we're pregnant, and we begin to have all these dreams and hopes for our children, and to think about the I'm going to mess that word up, but politicizing the race of your child in the womb, and how that could be an indicator of many outcomes in their lives. Just it was a gut punch, but very true. She talked about how um, the raping of women that were enslaved, and using Black women's bodies essentially to create the workforce, right? And also this concept of Black women, or not concept, the reality that Black women were used to rear other people's children, not allowed to care for their own. And Dorothy Roberts is a part of the documentary, and she expanded on this point that there is a bias that is created, or a bias has been created, and negative, and a perception that Black women don't take care of their children, and how that then manifests into what we see in our child welfare system. So for folks that don't know, outside of the work of Abetta Glenn, we all are full-time employed in other facets of our lives. But outside of Abetta Glenn, I do work for a national nonprofit that's focused on the foster care system. Is what most people know it as, the child welfare system. And we look at various ways to reform that system. It is a system just like our criminal justice system, the very systems, right, that have been created in this United States. And what that looks like is that there is an overrepresentation of children, particularly Black children, in the foster care system. And so when we say overrepresentation, there's more children, Black children in care, than the population of Black children. And that's sort of just been accepted as that's just the way it is, and that's just the way it should be. And so that direct connection to what that outcome could be to slavery was a point for me that that I knew, but it just further sort of planted this idea that certainly is an example of how that turns into outcomes that we see today. Laura, do you recall any other topics that we talked about in terms of how this shows up, particularly in our county and in our city?
Yeah. Actually, one thing that you mentioned kind of reminded me, in terms of what we talked about earlier about race being a product of racism and a product of the institution of slavery. You talked about how, and one of the things that they cover in the episode is that, traditionally from going back to England, a child's status was inherited sort of through their father. Mm-hmm. And it was a patrilineal heritage in that way. But that was actually switched in the US specifically to account for the situation where enslavers were raping enslaved women. That would, if they kind of kept the traditional historical lineage and tradition, that would mean that those children would have the same status as their fathers. But instead, it was legislated that those children of enslaved women and white men would inherit their status from their mother. So, I mean, that to me, that's a very clear example of, okay, if you don't like the way that the rules are, the impact that the rules or tradition is having on your society, on your institution of slavery, you just switch the rules and say, okay, you inherit your race from your mother, actually, and that makes the child Black, and that makes the child enslavable, and that means that we have a larger workforce for our plantation. So that's what I meant when I said that race and who is defined as Black, who is defined as any other race, that's a product of racism. That was very clearly defined and structured to support the institution of slavery and the whole economy that was built up around that.
Yeah, and then ultimately impacting individuals' rights. Like one of the highlights of the documentary was this couple who were trying to obtain their marriage license. I believe it was in the state of Virginia or the state of, and they ultimately went to the state of Florida. Mm-hmm. But they were asked to indicate their race, and the guy was like, I think he was from Africa. And
from Ghana, I think, yeah.
Of Ghana, yeah, it's such a foreign concept, right? And so, we know that impacted the ability for folks to get married number one. And then that whole one drop rule, right? That was also an indication of or a manifestation, if you will, after sort of the identifying race by the mother's womb as opposed to the father's lineage.
Mhm.
We also, there was a great question that someone asked, and I can't recall exactly how he asked the question, but it was to the effect of, why are Black children dying at a higher rate than white children here in Glenn County? And it was after your presentation. And we started to talk about the conditions that Black women in particular experience here in Glenn County. And we'll put these stats in the chat later. But I just wanted to highlight a few things about Brunswick and kind of talk about where do we think race implicates these things, and then what are some potential solutions. So a key data point is that for children under the age of 5 here in Brunswick, 43% are in poverty. 43% of children under the age of 5 are in poverty in Glenn County. And 10% of those children are without health insurance. Another data point, economics. About for Brunswick, 26% is poverty rate, and that's 55% of households are under the poverty rate. 55% of households are under the poverty rate, and the median income is less than $30,000 a year. So when I say those things, Laura, does anything come to mind for you in terms of what you see here? What conditions this creates for children and families, and how race shows up in this?
Yeah. The first thing that came to my mind was that's clearly not the case for all of Glenn County, that we are so, our county specifically is so segregated racially, socioeconomically. You can literally, start in Brunswick and take the Causeway and go through St. Simons and Sea Island, and pass through, so many varied levels of socioeconomic status and resources that families have access to.
Mm-hmm.
So yeah, that's the first thing that came to my mind, is that it's not only that we have such a high rate of poverty within Brunswick, but it's so segregated in our county. And I think part of I think it should convict us, as members of this community, as residents of Glenn County. It shouldn't be acceptable to us to have poverty levels that high. And I think I would challenge anybody who's kind of listening to this and again, feeling that what I felt watching that episode is kind of trying to distance yourself. Oh, that's horrible, but that's in Brunswick, or that's, I'm not experiencing that personally, or my family isn't experiencing that personally. I would encourage you to expand your definition of community to include more people maybe than what you currently are. And also just to re-examine how it actually is impacting you to live in a community where this is normalized and where it's the status quo. Even if you aren't one of those households that happen to fall below the poverty line, or are uninsured, or don't have the resources that you need to provide for your family, what is it doing to you? I'm getting a little spiritual here, but what is it doing to you, to your soul, to live in a community where 2 miles away that's the case, and it doesn't spur you to action, or it doesn't, you just think that's the status quo, and that's kind of how it is. So I would just challenge the folks in our community to not accept this as acceptable, and and to do something about it.
Mm-hmm. Yeah, I mean, I feel the same way, right? That a child or family, no one's experience, their quality of life should be indicated by their race, number one, and shouldn't be indicated by their zip code, which is what you brought up, Laura. That data I was speaking to was specific to 31520 zip code, Brunswick, Georgia. But we sit in the middle of the one of the richest zip codes, right? And there is a literal and physical divide. And so, children should not, their outcome shouldn't be indicated by that. One of the other data pieces that I was looking up, and again, I'll provide the data and the resources in our chat. It takes about 88 hours a week for someone to rent a 2-bedroom house on the minimum wage.
Which is supposed to be a livable wage.
It's supposed to be a livable wage, right? And we hear a lot of the narrative around people don't want to work. You can't find employment here, or there's a lot of jobs here, but people just don't want to work. We saw a lot of that coming out of the pandemic. But if it takes someone to work 88 hours a week to afford a 2-bedroom home, and they're more than likely, have children, what does that do for not only their quality of life, but their ability to participate in their children's lives? So that also kind of speaks to the cost of living in terms of rent. And so if you're not the costs are rising for rent, and the wages are going down. And so folks can't necessarily meet in the middle. And that led me to one of the pieces that we had talked about in terms of how could a Black child have a higher death rate, or Black infant specifically. And we talked about the conditions of the mother's body and the likelihood that she is working an hourly job that has very little benefits. That is, her pay is required on her attendance. So, more than likely not a salaried employee, working hourly jobs, as we mentioned, and more than likely also working in some type of labor, in terms of hospitality, nursing, something that requires one to give of themselves. And so it's interesting when you think about diversity in terms of not only race, but diversity in terms of employment, and that being a potential solution to eradicate some of the racial disparities we see here, because there is not a lot of diversity in the type of jobs that individuals could have. Any thoughts about that?
Economics really isn't my point. What I was thinking as you were talking about that is those are all factors that go into infant mortality and maternal mortality. And there's also the a little bit more hard to define factor of racism in healthcare. And we heard from our co-panelist's experience that she felt like she experienced that she wasn't listened to, that she wasn't taken seriously. And I think a lot about how to address that. I'm not a healthcare provider, but I work in clinical research. And I went to a conference last year on cancer care and cancer research, and listened to somebody present about this software tool that they were able to implement in a cancer center that I don't know how it works, or what the algorithm is behind it or whatever, but that flagged to cancer providers in real time when the decisions that they were making about a patient's care could potentially be prejudiced or be due to something other than how the patient was physically and medically presenting, in the moment. And they were able to show that just that kind of simple intervention of flagging to the healthcare provider in real time when, like I said, the decision that they're making for this patient seems to be different from the decision they're making about other similar patients based on their medical condition, that can have a real impact on the care that people receive. And so I don't know, that was in cancer care. I don't know how much we can apply that to other areas of medical care, but it is something that people are thinking about and trying to address. It's not easy, but that's kind of what came to mind, because we talk about the socioeconomic factors that go into these outcomes, but also there's also the fact of the interaction between the patient and the healthcare provider, and the potential biases and prejudices that may be there unintentionally, but may be there and may be manifesting in different outcomes for those people.
Yeah. Yeah. And, we would be remiss to not talk about how racism showed up in our own community. Yesterday was Ahmaud Arbery Day. And it makes me think about one of the things that she highlighted in the documentary, that race and racism is a part of our culture. It's in our DNA, our thinking, our behaviors. What happened to him, the murder of him was certainly driven by a belief about him that was based in his race, right? And we know that to be not only an opinion, but it was deemed a hate crime, right? So it was interesting to sort of think about or reflect back on those 3 years ago. Gosh, it doesn't seem like it has been that long. But also I can recall just sort of the reaction of a lot of folks to just want to discount racism to begin with. Like this, no, like it was just it was okay to just believe that he was a criminal, because he was Black, or he didn't belong in a particular neighborhood because he was Black. And that made me think about sort of that inherent muscle memory that folks probably don't even, and I'm not suggesting that the McMichaels couldn't name that, but the fact that it just existed, and there were so many people that wanted to say, didn't want racism to be an indicator of that for him.
Yeah, we heard that a lot in the community conversation. Like, this was in the very early days, that people were so quick to write it off as not related to race, or to find other reasons why somebody would chase him down the street. Yeah.
And so that just that makes me think about all the ways that we just accept the mistreatment of others, because we just believe that it is ingrained in people to be a certain way. And when you talked about the medical studies, that one of the things that she had highlighted was that some of the medical practices is still based on the belief that Black people's brains are different than white people, smaller, less able to have intelligence than white people. And so some of those things that we think are just asinine, it was just so long ago, they're still impacting current outcomes.
Yep, some of those myths that were part of that pseudoscience that was created to justify the institution of, like you said, that Black people have smaller brains, or that their skin is thicker, or that their lungs don't have as much capacity, or that they can't feel pain. You think about Dr. Sims, who was kind of the father of gynecology, and the experiments that he performed on enslaved women without anesthesia, even though it was available, because of this myth that they couldn't feel pain. And how do you rectify that with a woman in front of you who is in pain is hard to justify. But you're right. It's those myths that are so much a part of our culture, that are so just kind of the air we breathe almost, that you have to, it takes an active act of questioning it, recognizing it, like, oh, I'm thinking this because of this, and is this even based in fact? Yeah, it takes thinking against the grain.
Yeah, for sure. So we're not gonna give any more for folks that haven't seen the episode. Sorry. um, but I promise you it's still worth watching. We haven't we just touched a little bit on what we saw and what left impressions on us. We want to certainly want these conversations to lead to solutions. And as Laura mentioned, once you sort of take an active stance in unlearning and learning, we can get to some solutions. The next episode is on capitalism, and we will have a watch party for that episode this upcoming Sunday from 6 to 8 at the Coastal College in the Stempler Theater. This episode is just as dynamic as all of them, but really is going to unpack how capitalism was built on the institution of slavery. And again, how do those things show up for us across the nation, and how does it show up for us locally? So we certainly invite you to attend. We also have what we're calling our ABG library. We're offering free books to the community. Most of the books are connected to what you are learning in the episode. So please come out 6 to 8 p.m. Watch the movie, have some watch the docuseries, have some dialogue with us, and certainly pick up some books to expand your learning. There is a comment, and I don't want to miss this. Heather stated that she's also speaking about poverty in our community is an environmental justice issue as well. And Heather, you are so right. That's one of the things that we also talked about in terms of the conditions that people are living in. And sometimes when we think environment, folks just think about the coastline, the waters, our nature, and often don't think about the toxins that people are living in. Certainly the chemicals that come from the factories, but also the amount of mold as an example of what folks are living in. And we know mold has impact on development. So thank you for putting that in the chat, and we encourage everyone to click on that link. There's a study happening. We also talked about that on Sunday. I believe this is the first study that we've had where we're given an opportunity to really start to talk about the impact of these sites here. Laura, do you know any more about that?
Yeah, it's a really important study. It's not a study that has been done before. They're looking for people that have lived in Brunswick, I believe, in the city limits Brunswick for at least 10 years and are currently living in Brunswick. And it's looking to basically get data about the types of environmental contaminants that residents of Brunswick may be exposed to now and may have been exposed to in the past. Mm-hmm. And this is so important. We have some studies that have been done of the environment, but this is a study, with looking at the health outcomes mm-hmm. of being exposed to these types of contaminants. That data is so important. It's going to be important to guide future legislative priorities, I think, in terms of what we can do about companies that are polluting our area and linking that to specific health outcomes in our people. So I would really encourage you to look into that study. If you're eligible, I would encourage you to participate because that's really important information for our community.
Yes, it is. And it doesn't, the link, I did it about 3 weeks ago, and it's just asking for your information, your name, zip code where you live, and then further information will be provided to you. It doesn't take a minute to fill out. I would also say, just for folks that may have remembered, and this was quite a while ago, I think it might have been in the early 80s. I can recall the neighborhood that sits behind what used to be Hercules, but now Pinova. gave settlements to residents that lived over there. And that area was primarily African American, first time home owners. My great grandparents were one of those homeowners in that area. And, you know, God knows what health conditions they had as a result of that. But the fact that settlements were given to, as opposed to the study that we so desperately need. So this is a great next step and a right step for us here in Brunswick. And so I would encourage folks to do that. All right. Any last words, Laura?
I don't think so. Just looking forward to watch party number 3 this Sunday and hoping to see some of y'all's faces in real life.
All right. Thank y'all for tuning in.
Thanks, everyone.